In quadruped, we can begin to do static dynamic activities by involving upper extremity patterns or lower extremity patterns. A good pattern to use for the upper extremity is D2 flexion and extension, and we can use the technique either rhythmic initiation or slow reversals. What I'm going to have you do, Trish, is shift your weight over onto this arm and lift this arm up, bring it right back down on your hip, then you're going to open your hand, turn, and you're going to lift up and out. And you're going to squeeze, turn, and pull down and across. All right, I want you to open, turn, and lift up and out. I want you to look at your hand, squeeze, turn, and pull down and across. I want you to open, turn, and now lift up, right on up and around, and squeeze, turn, and pull down and across. Open, turn, and lift up and out. Squeeze, turn, and pull down and across. Open, turn, and lift. Stop right there. You need to be sure that as the arm is coming up, your manual contact, back down a minute, which starts lined up in this direction. As she brings her arm up, you have to pivot your hand so that you allow her to continue through the movement. And then you're going to shift all the way over on the volar surface of the forearm. Now squeeze, turn, and pull. And you can see that my arm is lined up in the diagonal. I'm resisting diagonal movement. Open, turn, and push right on up and out. And squeeze, turn, and pull down and across. Open, turn, and push up and out. Keep going, and squeeze, turn, and pull down and across. Stop right there. All right, so that's the static dynamic activity, D2 flexion and extension of the upper extremity. In quadruped, we can do static dynamic work involving the lower extremities using the D1 flexion and extension pattern of the lower extremity. You need to be positioned looking straight up the axis of the body, half kneeling between the patient's knees. One hand can be applying some approximation or light guarding over the static hip, and the other hand is going to be grasping on the foreleg, resisting the pattern. All right, Trish, I want you to shift your weight over onto this leg, and then I want you to bring this knee down and across toward the opposite arm, and now up and out. Like that, okay? Now bring it down and across, and up and out. And down and across, and up and out. And down and across, and up and out. And down and across, and now rest. And one of the things you should be noticing while you're doing this pattern is that there actually is some lower trunk rotation, the pelvis rotating this way as she brings the leg down and across, and then rotating up and backward as she brings the leg up and out. And the resistance, the amount of resistance that you give is really targeted by how the static side is holding up. And we could also do active motions such as lifting one arm up. So just lift this arm straight up ahead of you and down, and now lift this arm up. And we can alternate extremities, and now lift this leg up and down, and now lift this leg up and down. And then the most difficult yet would be to lift opposite arm and leg, which you can direct the patient to do by tactile cueing. Now lift this arm and leg up and hold steady. And down, and let's do the opposite arm and leg again, and hold steady, and down. All of those are different variations of static dynamic control that require one or more of the extremities to be moving while they have to stabilize the trunk in the quadruped position. In quadruped, we can also focus on static dynamic control by having her do some cone stacking activities. So you can have her continue stacking the cones, and you can vary the position of where she's placing the cones, and that is adjusting the amount of control that she has to do in that reaching activity. It also focuses on some fine motor control for the hand in terms of grasp, release, and eye-hand coordination. For skill level activity in quadruped, we can do resisted creeping, and it can resist this action both at the hips and at the feet. Very often, if you're resisting at the feet, it's easier to use wall pulleys and ankle cuffs than it is to do manual resistance. All right, so Trish, what we're going to do is I'm going to have you do some creeping now, all fours, down to the end of the mat, and then I'm going to have you go backwards, back up to where we are right now, okay? And I'm going to give you a little bit of resistance by holding onto your hips, right? Now, I want you to move opposite arm and leg together, all right? And I want you to start out by moving this arm first and this leg first, all right, on 3, okay? All right, so 1, 2, 3, and step, 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 keep going, step, 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 step. Okay, and now what I want you to do is go backwards again, starting with this arm and leg, taking a step backwards on 3, okay? 1, 2, 3, and step, 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 step. Okay, now the therapist times the stepping motions with the verbal commands and provides resistance through the pelvis. Now, as she's going forward, what you're going to do is to start the motion, give a little bit of stretch upward and backward to get this leg moving forward, and then provide resistance for the whole stepping motion forward. As she's coming backward, your hands are on the posterior buttock and you're providing the resistance in the backward direction. In the hook line progression, one of the first activities you would consider doing is rhythmic rotation, which involves lower trunk rotation in order to relax tone through the hips and lower extremities. So this would be very useful for a patient with a lot of spasticity through the lower extremities. You can start by positioning the feet right on your thighs, and you're going to put your hands on top of the knees, and what you're going to do is just gently rock them from side to side. So just relax and let me do all the work here. I'm going to move these hips from side to side, all right? And just relax. I'm going to go a little further each time, but I want you to just keep your eyes closed and try to stay relaxed. We're going to go from side to side and back again, and side to side, a little further each time, side to side. And what you will feel as you're doing this activity is a gradual reduction in tone, and the patient is able to let you go a little bit further each time. This is an activity that you can do for some time, a couple of minutes, 5 minutes. It may take that long to really relax a person who's pretty stiff with extensor tone through the hips. But it is purely a passive activity, and the patient just relaxes. In hook line, we can also do rhythmic rotation using the ball, and that allows us to rock these legs a little easier from side to side. And if there's a great deal of extensor tone, then this is a better position for the hips to be in because they're more flexed. And so you may get a little bit better relaxation of tone. Also allows fairly easy movement from side to side, particularly if you have a larger patient with a great deal of tone. And again, you would do this until you felt the patient relaxing. As you notice the action going on through the hips, you see that there's really a great deal of elongation of the trunk and rotation, which is allowing the relaxation to occur. You need to be in half kneeling so that you can shift your weight and move with this ball. And so probably the best position to be in is half kneeling across the bottom of the feet. And just relax and let me move you from side to side. This activity is hook line, lower trunk rotation using rhythmic initiation. Terry, what I'm going to have you do is just relax and let me move your knees back and forth, okay? I'm just going to rock them from side to side, and I want you to relax and let me do all the work, okay? Just relax and let me move them forward and back and forward and back, forward and back. Now move with me. Move those knees forward and back and forward and back and forward and back. Now pull forward and push back and pull forward, push back and pull forward and push back and pull forward and push back, all the way over, good, and pull forward, all the way over, and push back, keep going, and pull forward, and push back, and relax. In rhythmic initiation, there are 3 phases to the activity. The first phase is passive movement, and the patient is instructed to relax while you move the knees. Your hands stay on the top, they don't change their position. During the second phase, it's active assistive, and the patient's instructed to move forward and move back. During the third phase, it's resistive, and that's when your hands have to switch, pull forward from side to side in order to resist. And there's a little bit of a stretch that's used to initiate the movement in the return direction. And as you increase the range, then it becomes important to pivot the hands around so that you can follow the motion all the way through. In hook line, we can work on initial mobility through a technique called hold, relax, active movement. And this is going to be particularly directed toward weakness on one side. So in this case, the weakness would be in her left hip muscles, left medialis, and that's why I would be doing this technique. So Terry, what I want you to do is I'm going to bring your knees over here to this position. I want you to hold this position. Hold steady and don't let me pull them back toward me. Hold this hip here, that's it. Hold tight, hold, and now I want you to relax. And now pull those hips back away from me. Good. Now hold again. Hold tight, hold, and now relax. And pull those hips back and away from me. Keep going. And hold again. Hold tight, hold, and relax. And now pull away from me. Pull all the way over and hold. Last time. Hold tight, hold, relax, and now pull away from me. Pull all the way over and relax. All right, so the activity begins with an isometric hold in the shortened range, followed by passive relaxation. And as soon as I feel her relax and move her knees back through the lengthened range, and then I'm going to resist the contraction, give a little stretch here. Now pull all the way back through the shortened range. And I start the whole procedure again. Your manual contacts never move. They stay on just one side of the joint and provide the resistance. This is the leg with the weak abductor, so this is where most of the resistance is focused, and this leg is resisting the adductors doing a parallel activity. You need to be sure that you're positioned in half kneeling across the bottom and not in the way as these knees come back. So you need to be far enough down the body so the knees don't hit you. And you also need to be able, now pull away from me, to shift your weight forward in this half kneeling position so I can stay with the motion. All right, so we'll do it once more, okay? I want you to hold this position right here and don't let me pull your legs away, okay? Hold tight, hold, and now relax, and now pull away from me. Pull all the way over, and hold again. Hold tight, hold, and relax, and now pull away, all the way over, and hold tight, hold, and relax. And you'll notice each time I went a little further into the shortened range until she should be able to hold in the fully shortened range for this hip abductor.